Hello, my name is Dr. Stefan Tóka from the Dentalklinik Dr. Tóka in Sopron in Hungary. Dear patient, I created a three-dimensional planning for your implant placement. You were at our clinic for a consultation with my colleague, and he talked to you about implants, and I just managed to finish with the implant planning and would like to tell you everything about it. Okay, so let's get started. Here in this first picture we see a three-dimensional reconstruction of your lower jaw. We see on this side, this is your lower side, we see that one tooth is missing at this point. I guess the tooth was pulled not too long ago, so maybe some months, maybe some weeks. I can see still the places where the roots of the teeth of this tooth were sitting. Now, my colleague talked to you about the implants. The implants are basically small titanium screws that are inserted inside the bone under local anesthesia. Which means when you come to us, you will first get an injection of local anesthesia in this area, and only after the anesthesia starts working and you won't feel any pain, then we start placing the implant. First, we will take a small drill, make a little implant bed or a little hole basically inside the bone, and after that we place the implant. This implant needs to be covered by bone on all sides, towards the tongue and towards your cheek. One thing is very important. We need a minimum length of an implant. In your case, we can use an implant with a length of 11.5 millimeters. The minimum length we should use in the lower jaw is 8 millimeters. Luckily, you have more than enough bone. We can place a long enough implant for reconstructing your tooth in this gap. One thing I have to tell you about is a nerve which goes through the lower jaw. You can see it here in orange. I made it visible for you so you can understand what I'm going to tell you about. This nerve is responsible for touch sensation of your lower lip. So that means if we want to place an implant in this area, we need to know exactly where this nerve goes, because we do not want to touch the nerve with the tip of the implant. You can see that we keep a certain safety distance to the nerve, and we can still place a long enough implant, so there should be no problem regarding this nerve when we place the implant. Okay, let's go to the other side. You have a bridge on the other side, on your left side, and my colleague also talked to you about replacing the middle tooth of this bridge with an implant. I also made a reconstruction of this side. You can see I have placed quite a long implant. This implant is 13 millimeters long, so you have even more bone on this side than on the other side, and you can also see that we can keep a safety distance to your nerve. Just to sum it up, basically, you are an ideal patient for placing implants. You will see the entire treatment should not take longer than 20 minutes. You will get here. We will probably talk even more about it than the treatment will be. So you will get two anesthesia, local anesthesia, one on each side. Only after the anesthesia starts working, we start placing the implants, and we're going to be going to finish after 20 minutes. After we place the implants, you have to know that the crowns on the implants will not be placed immediately. The implants have to heal inside the bone for up to 4 months. 2 to 4 months usually in the lower jaw. I don't know yet. This is an information you will get from me only right after the implant placement. It really depends on your bone quality. With my CT, I can already see how your bone quality is in this picture. Sorry. In this picture you can see this graph. This line should be in the green area. The green area means ideal bone for implants. You can see that half of your implant length, this is basically a little sketch of the implant. You can see that the lower part of the implant, this part of the implant, is in a green zone, but the upper part is in softer bone. I'm going to tell you right after the implant placement whether we should wait 2 months or maybe 4 months. After the healing time of, let's say, 4 months, you come back, we take some prints prints of the tip of the implant, and 1 week after we have taken the prints, you will already get the fixed crowns which we will place on the implants. So that means you will need at least 3 appointments. The next appointment could be the implant placement, one on each side in one sitting. After that, we wait for 2 to 4 months. You come back, we take prints, and 1 week after we have taken the prints, you will finish the treatment and will have fixed teeth in the lower jaw. I don't know if you talked with my colleague about maybe just replacing the bridge on the left side. You have a bridge, which means that the tooth here in between these two teeth is held by the adjacent teeth. It is another option, but you have to consider these two teeth are already root canal treated. A safer option, if financially this option is fine with you, a better option would definitely be the implant. But we can also talk about this when you come to the next treatment. Okay, if you have any questions, you can write us an email or just call us. Otherwise, you can make an appointment for the implant placement. If you have any more questions, we can talk about it right before the operation. You can ask me anything. I will talk to you about this plan once more. I will explain everything exactly, and yeah, that's it basically. Thank you for listening, and bye bye.